field of medicine is a big thing for me. So, and also like I was born, I had a stroke at birth, so that's always been something I wanted to conquer. And so pretty much later on in life, I'm figuring out like I probably want to be a doctor. So before I get started, I want to go through 3 key ways we can cure either cancer treatments and neurosurgery. So you have chemotherapy, which is attacking the cells itself through chemical agents. Then there's radiation therapy, which you shrink the cells, then try to get it out. But then for neurological disorders, you go in through neurosurgery and attack the nerve that is infected itself. So then I found a new innovative way, which is in the field and kind of hard to get through. It's kind of controversial, and that is marijuana. So I'm not talking about you and your friends smoking a joint in your apartment on Tuesday afternoon because you're kind of bored. I'm talking about marijuana because of the good effects it has. Marijuana usually has a negative connotation to it, but here there's actually good things that go into it. So medicinal marijuana, defined by Mohammed Ben Ammar, is medical marijuana, refers to the use using the constituents of marijuana, including cannabis, THC, and the cannabinoids. And cannabis has actually been used as a medication since 2037 BCE. So before I go any farther, I'm going to explain from the perspectives of different people, different medical professionals and how they feel about it. So from Jocelyn Elders, who's the former Surgeon General of the United States of America, she says that the evidence is overwhelming that marijuana helps increase the appetite, get rid of pain such as vomiting, nausea, and pretty much helps people who have cancer, multiple sclerosis, and AIDS. But then Bill First, who's a former senator and also a medical doctor, believes that marijuana itself is a dangerous drug, and there's better drugs out there that relieve the same symptoms that are less dangerous, less harmful. And then the health risk of smoked marijuana. There's Lester Grinspoon, who's the former dean and marijuana smoker. He was a dean of Harvard Medical School, so I would assume he knows what he's talking about. He says there's little risk of smoking marijuana itself. It's been smoked for decades, and there's been no connection between marijuana and lung cancer or emphysema. But then the British Lung Foundation found that 3 to 4 cannabis cigarettes a day, a joint, can be associated with the same evidence as acute and chronic bronchitis with one that smokes 20 more cigarettes a day. So we can kind of see from there that one side's saying it's not connected to emphysema or lung cancer, but the other side's saying it's connected to bronchitis. So the evidence itself kind of weigh each other out. Then treating AIDS with marijuana. Now, as we all know, there's not really much of a cure for AIDS yet, but we're kind of trying to suppress the side effects that people have when they have the disease. So Donald Abrams found that patients who, he was involved in a study where one half was given a placebo, the other half was given marijuana. The one with marijuana had improved immune function and on average gained 4 more pounds than those given the placebo. But then the Institute of Medicine report did the same exact thing and found that the immune system grew in the fungal and bacterial diseases, and this is suggesting here that marijuana perhaps just depresses the whole immune system and gives us unneeded pathogens in our body. So pretty much what I'm trying to get at here is that we have one side that's saying, yeah, you see, it will help you gain more weight, and there's another side that was saying it will suppress your immune system. So overall, in conclusion, we can see that marijuana itself is always going to be a controversial topic, and there's no way around it. Even recreation use, everyone's going to be controversial towards it, good or bad. But even in the field of medicine, people, I think, sometimes are either too biased, saying marijuana can't be good or bad, because they just always think of it bad. But then you also have that other side that's very liberal. They'll think it's always good and will approve of it. So pretty much there's never going to be a right answer as to how marijuana should be used in the medicine field, but eventually one day, hopefully, we'll get it right and find some sort of compromise and help the people that are sick out there.